Dr. Wood, author of the book Miracles in Minutes. Today we're going to talk about focus and diagnoses. So one of the things that I discourage in my office is a diagnosis. I use a diagnosis for insurance purposes. You know, every insurance company wants a diagnosis, but we're not going to rely on the diagnosis for the care path. The reason for that being, some of it has to do with brain function and understand the brain. So, for example, someone's diagnosed, I have pain in multiple spots in my neck, I have pain in all these other areas, diagnosis is fibromyalgia. Well, that's an accurate diagnosis. That's true. What's the problem with it? What happens is the person then starts to identify with the diagnosis. And identity is a very powerful thing in the brain. If someone identifies themselves as a runner, they get the shoes, they have the gear, I run. And you'll see them running all the time. That's their identity. So when people identify with something, they become that. So why would you want to become fibromyalgia? I don't want you to get confused. I don't want you to think that I'm not saying you don't have a problem. I agree with that. What I want to do is move off the diagnosis and just stick with the feelings. It hurts here, it hurts there, it hurts this. Another example, I have postpartum depression. Okay, that's the diagnosis. The feelings are, I'm extremely sad, I feel helpless, I can't get up, I can't move. That's the feelings, okay? The diagnosis, so you go get the diagnosis of postpartum depression. Okay, how much better are you? You're not. You're not better by having the label. You're not better by identifying with the condition. What's missing is, so let's go into something else, okay? So what we need to do is look at this matrix here, okay? So diagnosis, I don't like those. The symptoms are true. You can stay with the symptoms, but what we need to do is put the focus. See, this is the problem. What we want to do is create the solution, okay? What is it you do want? Do want? How do you want to see yourself living? Now we're going to have to, and what sort of feelings would you like to feel? Okay, so a lot of times, I'll give you another example. There was one lady I know, she was getting ready to go on a flight, and she's like, oh man, I'll just get so nervous getting on an airplane. You know, every time, here's her statement, I go on a plane, I get nervous. That's what she said to herself. So she had these thoughts. Her thoughts were, every time I go on the plane, I get nervous. So up here is the creator. It's the yes, no. It's the chooser. And it can listen. Okay, listen. So if that's the thought and just accept it, the creator then creates the feelings and creates the future reality of always being nervous on an airplane. What she can't do is see herself being a different way there. So what I did is I asked her a question. You ever felt a time when you're really calm? Yeah. Can you imagine, so I'm using her creative mind. She's imagining herself being scared to death on the plane, and then she projected that into the future. And now she's claimed to her brain and subconscious mind to create this experience. Be nervous on the plane. What we can do is create a new experience. What do you want? Can you imagine being calm? Remember a time when you're calm? Yeah. Can you see yourself walking in the airport, feeling that calmness? Walking, sitting on the plane, being calm, and going, wow, this is pretty cool. Sitting in that calmness and being calm the whole time, maybe having a conversation on the plane. Getting off and going, wow, that was awesome, I did it. See, and unless we become proactive, we're kind of passive. We're letting things just happen to us. You know, you can choose to think differently about a situation. So, in my office, one of the first things I do with all patients that I work with is, you know, let them talk about the problem, let me hear the history and all that stuff. You know, I want to hear you out. You know, if certain things are mechanistic, you know, you tried every care path and nothing's worked, you know, then maybe you need surgery. Okay, I have no problem with that. Mechanistic, 20% of life's mechanistic, 80% is vitalistic. So, but if we haven't even used our brain yet to get involved with care path, let's do that. So we'll cover a little bit of research in regards to the brain. And we're going to talk about fight, flight, or fear, and freeze. So when we get symptoms, we start to feel helpless. Again, we're listening to the feelings coming up from the body. I'm not saying deny your feelings. You don't want to deny symptoms you're having a heart attack. And you don't want to deny some thoughts that says go to the hospital. Maybe you need to go. The question is when it's not that, and now the brain's just running a loop and just creating a scenario of anxiety or postpartum depression or fibromyalgia. You're just caught in this loop. No one's making a new choice. You haven't focused on what you do want and the feelings you do want and neuro-associate them together to create the life you do want. You're just going to stay stuck in the disease the rest of your life. And you're going to read about it and identify with it more than join a support group. You're not any better, but you got a lot of people to talk about the symptoms with. What do you want? And I'm not making you wrong either. What I want to see is you can have something different if you use your brain appropriately to get involved. So we get pain, we get things that are going on, we don't know what happens. There's an area in the brain called the amygdala, okay? And it's in our brainstem, and it produces a fight, flight, or fear response. Okay, so my lovely drawing of the brain. And there's a left brain and the right brain. What they found out about the right prefrontal cortex, if we go over there, we tend to create worry, anxiety, depression, anger, a lot of the negative emotions. If we go to the left prefrontal cortex, which is awareness, or the observer, you just observe life. You're not in your head thinking. You're not. See, the right prefrontal cortex is more like, what about the past? And, I don't know. It starts running a loop. Like, I'm trying to fix it. And let me see if I can analyze that. And I don't know. And I can't believe I said that. And wow, I wish I'd have said something different. And, it's like I broke my leg years ago. Gosh, I wish I never would have broke it. If I would have broke it, then things have been so much better. How do I go about unbreaking it? I don't know. You can't do anything about that. You're stuck in a loop. You're running and you're running and you're running. That's how you drive yourself, anxiety and depression, all those things. So what can we do is you get into your deep breathing, like I talked about in some of the other videos, calm down. And then you get into awareness, just looking in the room, and then generate thankfulness, appreciation. When you generate appreciation and all those things, the left prefrontal cortex will shut the amygdala down. It's like a seesaw. If the amygdala takes off, it's just running and running and running like a train down the tracks. The horse is off and running, scared to death. If we bring in the left prefrontal cortex and bring the breathing and the awareness and appreciation, the amygdala turns right off. If you continue to practice that on a regular basis of appreciation in your breathing, you can start to wake up every day in states of thankfulness, and you've created a space for yourself. Even if you do have a fear response, you can't avoid fear, but you can remember what you practiced. So it's just like the military. If the shit hits the fan, you're going to go to what your most competent practice is. So the more you practice being aware, breathing, and being appreciative for things, that becomes a higher level of competency. You get a fear response, you can be aware of it, make the choice, do I want to be afraid here? Take a deep breath, and then get into your states of gratitude. Dr. Wood talked about diagnoses, why I don't like them, because a lot of times it has a person stuck in a problem. And then when we go to care paths, you may even reject care that's actually working for you because you believe it won't work. See, one of the hardest things to get over in all science, including the pharmaceutical industry, is the placebo effect. If a person believes it'll work, it does. If a person believes it won't work, it doesn't. Dr. Wood, have a great day.